Hey everyone, and welcome. Today, we're going to go on a really fascinating and, let's be honest, kind of strange tour of our own anatomy. We are exploring hernias, which are really just the story of what happens when our body's own internal structure has a weak point. Okay, let's get right into it. I mean, just think about it for a second. Our bodies, they're incredibly well designed, right? But they're not perfect. So what happens when one of those internal walls that's supposed to hold everything in place just gives way? Well, that is exactly what we're here to break down. So our first stop on this little anatomical tour is the most basic question of all. You've definitely heard the term hernia before, but let's nail down what we're actually talking about. What's really cool about this is how simple the core idea is. Just imagine an inner tube inside of a tire. Now, if that tire has a weak spot or maybe a small tear, what happens? The inner tube bulges right through it. And that, in a nutshell, is a hernia. It's just something from the inside pushing its way out through a weakness in the wall that's meant to keep it contained. Okay, let's move on to our next stop. We are heading to the single most common location for hernias, and it's not even close: the groin. This is where things start to get a little more specific and, frankly, a little more complicated. So, down in the groin, or what we call the inguinal region, we mostly see two main types of hernias: direct and indirect. Now, they happen in the same general neighborhood, but from an anatomy standpoint, they're completely different animals. Let's break down what makes them so different. Okay, so this table really lays it all out for us. First thing you'll notice, indirect hernias are way more common. And that's because their cause is congenital. It's something you're born with. It's a failure of this little structure called the processus vaginalis to close up properly. Direct hernias, on the other hand, are less common and happen through a weakness in an area called Hesselbach's triangle. And check out their location relative to this key blood vessel, the inferior epigastric artery. Direct is medial, so closer to the midline, while indirect is lateral, so away from the midline. It's these tiny anatomical details that make all the difference in the world. All right, we have totally covered the basics. So now our tour is going to take a little turn towards the weird. Let's look at some of the more unusual and sometimes way more dangerous types of hernias that can pop up elsewhere in the body. This is where it gets really interesting. So first up, we've got the Spigelian hernia. This one shows up right along the side of your six-pack muscles. Now, the source material actually had a pretty funny note on this one. It says, this type seems like it was specifically designed just to mess with you, mostly because its location can be so incredibly tricky to diagnose. Now, this one is sneaky, and it is very dangerous. With a Richter hernia, only a small part of the bowel wall gets trapped in that weak spot. So here's the crucial thing. You might not get any of the classic symptoms of a bowel obstruction, but that tiny little trapped piece of tissue, it can still lose its blood supply and die. And that is a huge medical emergency. Next up, we have the obturator hernia, which has picked up the memorable nickname the old lady hernia. You tend to see it in older women, especially those with conditions that crank up the pressure inside their abdomen. We're talking things like a chronic heavy cough from COPD, or maybe having had multiple pregnancies. And here is a brilliant little clue for spotting that obturator hernia. It can actually press on the obturator nerve, which causes what's called paresthesia, that weird numbness or tingling feeling, all the way down the inner thigh. It's called the Howship-Romberg sign, and as the source points out, the name sort of sounds French, which for whatever reason makes it way easier to remember. Okay, so far, every hernia we've talked about creates some kind of bulge you might be able to see or feel. But what if they don't? Our tour is now going deep, deep inside the abdomen to explore hernias you can't see from the outside at all. That's right, we're talking about internal hernias. This is where loops of your bowel actually slip through a defect within the abdominal cavity itself. They're not common, but man, they can be an absolute nightmare to figure out. So the most common type of these internal hernias is the left-sided paraduodenal kind. It makes up about 3/4 of all cases. It happens through this specific defect called the fossa of Lonsert. The classic look is this cluster of bowel just trapped in the upper left part of the abdomen. And what's really wild here is the symptom. Patients might actually find that their stomach pain gets better after they literally rub their belly. How strange is that? The other 25% are on the right side. These happen through a different defect called the fossa of Waldier, and they're often linked with the intestines just not being rotated correctly during fetal development. In this case, that sac of trapped bowel is found on the right side, kind of tucked behind a major artery. So we've seen hernias in the groin, on the abdominal wall, and deep inside the body. But our tour really has to wrap up with the one critical risk that connects every single one of them. What is it that makes any hernia a potential emergency?
And that brings us to the most important point of all, strangulation. This is what happens when the tissue that's pushed through that weak spot gets squeezed so tightly that its blood supply is completely cut off. When that happens, the tissue begins to die. This is a true surgical emergency, and it's the ultimate danger with any type of hernia, whether you can see it or not.
And that pretty much brings us to the end of our tour. You know, this final quote from the source material just perfectly captures the essence of what doctors are looking for when things go wrong. Whether it's a bulge you can see with your own eyes or some hidden internal problem, it all comes down to this simple but powerful image. A sac of bowel trapped where it just doesn't belong. It's really a stark reminder of the hidden weak points that are inside all of us.